neuropsychology is a fascinating field to be in because the brain is so complex and fascinating. We know a lot about a lot of organs in our body, and we know a lot about the brain, but there's a lot we still don't know about the brain. The field is very interesting. It's very dynamic. It's ever changing in the different methods we have for learning more about the brain and things like that. I think it's important to know that, when you're in as a neuropsychologist, there are some benefits. We may get paid less than our medical counterparts, but we often will have a much better work-life balance. Neuropsychologists are rarely on call late nights and weekends. We tend to have more normal hours, and that's a big benefit, I think, of being a neuropsychologist.
Especially in medicine, it's huge.
Correct. Yeah. I know I have my weekends protected if I want.
Always a positive. And you have a family as well. So
I do. So I spend a lot of time with them. Yeah.
Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
So I'm here with Dr. Sabsevitz from the Mayo Clinic down in Jacksonville, Florida. And he's just going to introduce himself and a little bit about what he does. So I guess we'll start with, what is your place of employment and what is your official career title?
Sure. So I am a clinical neuropsychologist at the Mayo Clinic in Jacksonville, Florida. I work in the Department of Psychiatry and have joint appointment in the Department of Neurosurgery.
Awesome. And then with all of that going on, what does a typical day look like for you?
Yeah. So, so I see patients both in the outpatient clinic as well as over in the hospital, and I'll explain that in just a moment. My outpatient clinic, I see all sorts of patients with different neurological and neuropsychiatric conditions. For example, we'll see elderly individuals where there's a concern that there might be possible dementia present. I'll see patients with epilepsy and brain tumors and traumatic brain injury and strokes. And as a neuropsychologist, what I focus on is cognitive functions. So we have different instruments and tools that allow us to test different parts of the brain and better understand the impact of different injuries and diseases on brain function. So I'll see patients in the outpatient clinic. I'll do a clinical interview where I gather relevant history, and then we put them through a neuropsychological exam where we do all the testing. So that's what I do in the outpatient clinic. But a big part of my practice is spending time in the operating room. As a neuropsychologist, I do what's called brain mapping with the awake neurosurgery team. So I'll explain that. In some cases where we need to do surgery in certain parts of the brain where there may be important functions, we keep our patients awake during part of that surgery. And what I do is I help the neurosurgeon figure out where important functions are located so they can tailor their resections and try to avoid those important functions. And these surgeries are for removal of brain tumors, epilepsy surgery, where we're trying to remove parts of the brain where seizures are coming from, things like that.
Gotcha. And, you called it your practice. What do you like most about your practice?
Yeah. I like the variety. No two patients are the same. Again, I'll see all sorts of different types of injuries and diseases. And even within the same populations, like take brain tumors, every surgery is different. We learn something from every single surgery. So I enjoy that. I enjoy the high level of intellectual stimulation that comes with this job. A lot of my work is multidisciplinary in nature. So I'm spending a lot of time talking with neuroradiologists, neurologists, neurosurgeons, and as we conceptualize cases together, we learn from each other. So there's definitely a lot of stimulation that comes with the type of position that I'm in.
How would one educationally go about getting to a position like you? What is the highest level of education needed to be in your position? Where did you complete your education?
Yeah. So neuropsychology is a specialized track within clinical psychology. So if you're going to pursue a career in neuropsychology, you're going to go the route of getting a doctorate degree, a PhD in clinical psychology with specialization within neuropsychology. And what that looks like is, you'll complete your 4-year bachelor program, and most people major in psychology. Sometimes they'll major in biology and sciences like that. After your 4-year college degree, you'll apply for and hopefully get into a doctorate program. And Doctor programs can take 5 years. The average is probably 5 years. Some people take longer than that. And that's intensive coursework in both the field of clinical psychology as well as neuropsychology. There's a lot of clinical practica that you'll do where you go to hospitals and different rotations to learn about the clinical delivery of services. And there's a big research component as well. So in order to get your doctorate, you have to, typically you'll do a master's thesis, which is a smaller project, and then you'll do a doctoral thesis, which is a much more ambitious project. So that's the typical educational route. And then once you finish your doctorate program, you'll do a 1-year residency in neuropsychology, and then 2 years of fellowship after that. And then once you're done with that, you can call yourself a neuropsychologist. You can practice. We encourage people to then go on further and get board certified, which is a very prestigious process that you go through where you take all these different exams, written and oral exams and things like that. So that's the typical educational path for a neuropsychologist. As far as my background and training, so I graduated from Penn State University, go Nittany Lions. Not much to be happy about this last year for football, but after that,
everyone has to rebuild.
Correct. After that, I went to Chicago Medical School, which is now called Rosalind Franklin University of Health and Sciences. And that's where I earned my master's degree, went on for my doctorate degree there. I did my 1-year residency at Long Island Jewish Medical Center, and then I did a 2-year fellowship at the Medical College of Wisconsin. And after that, I stayed on as faculty there, where I worked my way up to an associate professor level. And just a couple of years ago, I left the Medical College of Wisconsin and came down here to Mayo Clinic to help build their neurosurgical awake mapping program.
Awesome. What are 3 skills needed by someone to be in your position?
Ooh, that's a tough question. Motivation and drive. There's no question. I mean, and it's the same going to medical school and going down different medical pathways. You have to be persistent. You have to have drive. You have to have motivation to endure the many, many, many years of school that you're going to be in, and the challenges that you're going to face. I think intellectual curiosity is got to be a big one up there. You have to have that thirst for kind of learning and kind of deep diving topics and making yourself an expert in whatever area you want to be an expert in. In psychology, you have to have good people skills. You have to be able to read people and interact with people and build rapport very quickly, to make patients comfortable as you work with them. So those are some important ones. I mean, I'd put those up in the top.
What type of classes should students start taking now that have an interest in being in the neuropsychology profession?
Now, being at the high school level or college level?
Either.
Okay. Yeah, you can actually start pretty early on in high school. And in high school, there's AP psychology and AP biology and things like that. And some motivated high school students will do observerships and even research projects. I've mentored some high school students when I was in Wisconsin, and they did some neuropsych related research projects. That's not necessary at that stage, but the key is doing well in all your coursework. You're going to take your psychology classes, your AP psychology classes, and really scoring well on standardized tests. That's what colleges are going to look for. Obviously, once you get into college, the key thing in college is obviously you got to do well grade wise. It's so competitive to get into a doctorate program, just as competitive as medical school. But you got to do research to separate yourself, from others. So relatively early on in college, I would recommend students, finding different research labs and volunteering your time. Research labs love volunteers. You'll start with data entry and things like that, but you'll work your way up and you'll learn about statistics and research design and hopefully even get involved in projects where you can get your name on publications or presentations. So I think that's really important in college. I mean, the coursework depends what your major in. You're going to have to take all your requisite psychology courses and statistics, but you'll probably also take, biology and maybe some neuroscience courses and things like that. But it's really, getting involved in research. You're not going to have a lot of opportunity to do clinical work in college, but you could do observerships and things like that. So I think by doing that is kind of how you set yourself up, to hopefully get into a competitive graduate program.
Being where you are now at Mayo in Jacksonville, can you explain how you operate cooperatively with whether it be surgeons or other people of a medical
Right.
team?
Yeah. So the type of work I do in the operating room, the only way to do it is, collaboratively and multidisciplinary. The patients that come here for brain surgery undergo extensive workup. That includes structural brain imaging and advanced brain imaging, something that's called functional magnetic resonance imaging and things like that allow us to look at the function, not just the structure of the brain. They're seeing neurologists and getting neurological exam and workup. They see me, the neuropsychologist, and go through extensive cognitive testing. And then they have to meet with other teams like the anesthesia team to go over any risk factors for being put under anesthesia, and obviously meeting with the surgeon. So, we all are part of this comprehensive workup. And when we actually get into the operating room, we need to take all that information and synthesize that so that we can effectively treat our patients. And the only way to do that is to be collaborative, being able to talk with the different providers, taking each piece of information and putting it together. I think of brain surgery, coming up with a strategy like a puzzle. Each little piece of the workup fits together and helps inform what we want to do during surgery. So what it looks like is a lot of conversations, formal conversations where we might sit down in a case conference where each of us present our different piece and kind of talk through different things, how we want to come into the brain, where we want to be careful. Some of it's more curbside. It's not uncommon in the operating room, surgeons walking in and he'll say, "Hey, Dr. Sabsevitz, give me the quick, rundown on what I need to, know and what I should be looking for." And we'll have a conversation right there. But then even during surgery, it's this constant back and forth between the neurosurgeon and myself, because I'm doing all the testing during brain surgery. He's doing all the cutting during brain surgery. We have to have a dialogue back and forth. So that's sort of what it looks like on a day-to-day basis.
Fascinating. Mm-hmm. And then, because this is going to be going to high schoolers who are going to be interested in careers such as this, what would you say the salary range starting out to, or what would you say the salary range is for someone starting out as a neuropsychologist, probably post-doctorate program, post-certification?
Right. Yeah. Yeah. I mean, it varies quite a bit by setting and the type of work you do. So in an academic medical center, for example, there's some published data, I think a salary survey, and I would say the average into an academic medical center right out of postdoc, anywhere from the 90s to the low 100s probably. Now, with that being said, there are locations that pay more, and depending on your practice, forensics, for example, you tend to get compensated quite well from forensic work. So being in the legal arena. In private practice, you have a little more control over your salary. Sometimes it's, you eat what you kill kind of thing, and you can see more patients and make more money. But I mean, the typical starting salaries, hovering somewhere around 100, I would say. We make less than our medical counterparts, and we don't often have loans that are less. It depends on how you work all that.
And right now, as you being kind of at the top of the profession, working for Mayo and having this brain mapping system, what opportunities for advancement exist as a neuropsychologist?
Right.
Or how does one go about advancing?
Yeah. Well, in academia, we have the academic rank and tenure. So you come into a location maybe as an instructor or an assistant professor, and over the years of showing clinical and research productivity, you advance from assistant to associate, and hopefully eventually to a full professor when you have sort of a more international reputation. So that's how you advance up the ladder in academia. You can also get involved in all sorts of different boards and meetings and take leadership positions and things like that, and advance in your field because you'll become more well known as you participate in those type of things. A lot of neuropsychologists do research, and you advance by applying for grants and being awarded grants and being productive in publications and things like that.
Awesome. Well,
cool.
Thank you so much for taking the time.
All right, buddy.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.